Good morning, friends. Welcome back to my YouTube channel, Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel. Also, please give a valuable comment. We also all topics in a very systematic order, so it's quite convenient for the study purpose. I hope you will make use of it. Thank you very much. So we were discussing differential diagnosis of muscular dystrophy. We have seen the myotonic dystrophy, we have seen the limb-girdle muscular dystrophy, we have seen embedded reflex muscular dystrophy, and now today we look into congenital muscular dystrophy. Congenital muscular dystrophy is also one of the very important differential diagnoses. The term congenital muscular dystrophy includes the group of dystrophies with the autosomal recessive inheritance. See, autosomal dominant, to some extent we have limb-girdle. Okay, one other variety of the limb-girdle. Whereas autosomal recessive, X-linked recessive are many are there, starting from embryo refuse, DMD, BMD, all are X-linked recessive. But congenital muscular dystrophy is autosomal recessive, male and female both affected. Autosomal recessive inheritance, which onset right from the birth and runs a benign course. Onset will be there from the birth. So child will have some feeding problems, child will have some the reflexes, diminished reflexes to some extent. From the beginning itself, if you observe closely, keenly, you will find some of the symptoms. And it runs in a very benign course, very slowly it runs. Okay, so autogrypsosis is present in all. That means the stiffness of the joint will be there. The muscles of the trunk and limbs are thin. When you look into these patients, the muscles of the trunk and limbs are especially thin. The facial muscles are minimally affected. Tendon reflexes are also poor or absent. Tendon reflex, because congenital myopathy is there. So tendon reflexes are either poor, diminished, or they are absent. Now, among the congenital muscular dystrophy, the most common form is Fukuyama types, which is seen in children of Japan, Dutch, German, Turkey, etc. Okay. So additional features are cardiomyopathy. There may be cardiomyopathy, mental retardation, seizures, microcephaly, and also the growth failure. Okay. Anyway, the muscle biopsy is diagnostic. So this is about the congenital myopathy. Apart from that, we have got some other myopathies, which is called as endocrine myopathies. Sometimes even the steroid-induced myopathy. For example, myopathy in Cushing syndrome, or rather Cushing disease, and also in Cushing syndrome, iatrogen. Cushing syndrome, iatrogen because of steroid intake, and Cushing's disease is naturally the adrenal hormones are not produced. So Cushing disease is also characterized by proximal weakness, high serum CPK level, and also EMG positive reports, and myopathy in muscle biopsy. Okay, so apart from all these muscular dystrophies and all those things, myopathies leading to muscle destruction and raised CPK level may be even seen in some of the endocrinopathies like steroid-induced myopathies. Children taking long-standing steroid, for example, in case of asthma, maybe nephrotic syndrome, or idiopathic arthritis, dermatomyositis, SLE, etc. So may develop these particular myopathies. Another important myopathy related to endocrine is thyroid myopathy. Hypothyroidism is the most common cause. Proximal muscle, as we discussed many times in previous case studies, proximal muscle weakness may be seen in case of a hypothyroidism, and hypotonia will be also there. Okay. Similarly, we can also find parathyroid myopathies. These are all endocrine myopathies. And we can also have the metabolic myopathies. Metabolic myopathies means these are the group of the secondary myopathies which are due to failed energy production as a result of abnormalities in glycogen, lipid, and mitochondrial metabolism. Because some inborn errors of metabolism leading to all these problems, and as a result, muscle is not getting the proper amount of the glucose or glycogen, etc. And as a result, the muscle cells will go for hypotonia. Okay, so this group includes many other conditions also, like potassium related periodic paralysis, channelopathies, what we can say, and malignant hyperthermia, glycogenesis, mitochondrial myopathies, lipid myopathies, and vitamin E deficiency myopathies. So they can be the causes for this endocrine myopathies. This can happen in children, this can happen in the adult population also. One more set of the myopathies that need to be differentiated where muscle weakness will be there. So that is inflammatory myopathies. As the name suggests, there will be pain, swelling, everything will be there. But in other dystrophies, muscular dystrophies, only there is a muscle weakness will be there with the pseudo hypertrophy and there is no pain at all. So this is seen in conditions like dermatomyositis, polymyositis, focal myositis, inclusion body myositis, trichinosis, SLE, etc. Immune system overreaction is a main cause because this dermatomyositis, etc. is autosomal disorders. So most common inflammatory myositis is dermatomyositis, as I told earlier. This is a small vessel vasculitis and the muscle weakness, symmetrical and also proximal. Proximal muscle weakness will be seen. Okay, symmetrical involvement is also seen. So there will be involvement of the neck flexures, commonly with the dysphagia. So again, the diagnosis is confirmed by serum CPK, EMG, and muscle biopsy. One more set of myopathies are toxic or drug-induced myopathies. So apart from the steroids, other drugs like excessive growth hormones, statins, cholesterol lowering, satin, there is a spelling mistake, sorry for that, statins, alcohol, chloroquine, vincristine, labetalol, colchicine, heroin, cocaine, zolpidem, penicillamine D, etc. So they may also lead to myopathies. So this has to be differentiated. You will get a clear-cut history of a drug intake. So this is all about the important differential diagnosis of Duchenne's muscular dystrophy and Beckett's muscular dystrophy. In the next class, we will see all the details related to DMD and PMD, which is our main topic. Thank you very much. Till then, goodbye. Please don't forget to subscribe to my channel and also please give your valuable comments. Thank you very much.